back to the Dad Chronicle. I'm your host, Alex Albisu. This is episode 142. On today's episode, I welcome back a friendly voice to the show, Dr. Gerry Tolbert. Decisions around medicine and health, whether that be for yourself or your family, it's never been more complicated than it is now. There are a lot of different opinions and different ways that people are encouraging folks to think, whether that be online through social media, AI, and even the current administration, that creates uncertainty, especially for parents and how we think about things, ranging from vaccines to the medicine that we take every day to just making the right decision on how we should live a healthy lifestyle. With this in mind, I wanted to bring Gerry back to the show to talk about how we navigate this, especially as he has a new project on the horizon that might benefit a lot of parents to listen to that would help solve some of these problems. So first, we talk about the current state of politics and how to navigate the facts around healthcare and science.
There's a lot of discussion of things that kind of prey on the fears that parents have. We all want our kids to be healthy. We want them to be safe. At least I hope we do. And because of that, there is a lot of emotion surrounding taking care of kids and being a parent and taking care of yourself and dealing with healthcare.
We talk about the uncertainty that a lot of parents live with on how to make the right decision for their child.
And I think that, as parents, that's one of the hardest things sometimes to do is we want to make a definitive decision and we feel like we have to make it right now because our kids are only young for so long. But it is okay to say, I don't know.
And finally, we talk about the right ways to go about doing research and properly educating yourself to make the right decisions.
That means that you can't just focus on headlines. And so that's going to be the hard part for gathering information quickly because we live in a headline society, unfortunately.
Here's my conversation with Dr. Gerry Tolbert. Dr. Gerry Tolbert, welcome back to the Dad Chronicle. How are you?
I'm good. Thanks for having me back.
Oh, man, it's so great to have you back. You've been on a few times now. First of all, it was great to see you in Las Vegas for the TMS meetup that we had earlier this year. Great to also meet your wife. That was so fun.
Yeah, we had a blast, and it was really good to get to see everybody in person and really get to hang out and have some time to talk about things in depth.
Yeah. By the way, what was your favorite kind of touristy thing that you did in Vegas?
We didn't do nearly as much touristy stuff. Driving underneath Sphere was pretty cool, just seeing it from the outside. And every time we drove by it, our Uber or Lyft driver had a great story about the guy climbing to the top of it. But
every time, yes.
Yeah, every time.
Every time. There was, well, you and I shared an Uber out to one of the events, and the guy mentioned it. There were a couple of other times where we were driving by the Sphere, and I kept making a comment of, I haven't seen the Sphere yet. And he was like, there's a guy that climbed that thing, that? And that was like a common thread. That must have really kind of transcended the culture over there. It's kind of funny.
Yeah, and there's always something crazy going on. That just happened to be the thing of the month, I guess.
Yeah, it is Vegas after all. Speaking of crazy things that are going on today, we're talking a little bit about kind of the current state of medicine in the United States. A lot of conflicting things in coming out of the administration, and Gerry, as a doctor, a medical practitioner, I thought it would be really valuable to have you on. So why don't we take just a quick moment and recap a little bit for those who may not have heard your voice before. Tell us a little bit about yourself, perhaps a little bit about your family, but then also really, most importantly to this conversation, how that is relevant to your work as a doctor.
Sure. So I am a board certified family physician. I did medical school training at the University of Kentucky and then did my residency in family medicine at Greenwood, South Carolina at a place called Self Regional. And during my medical school training, I also did 97% of a master's in public health and in biostatistics and epidemiology. So I have a background in mostly public health and patient care. I've been practicing medicine for about 18 years at this point. And I'm currently working, let's put it that way. I'm currently working in a small clinic that is a hospital-owned clinic in Lehigh Acres, Florida. I am doing what is essentially the equivalent of something called a federally qualified health center, which is an outreach program that was designed by the federal government many, many years ago to help in underserved areas. So most of my patients are Hispanic and Haitian immigrants, and we take care of them regardless of ability to pay. That's what the clinic was set up for by the hospital, which is actually quite rare. So all of the things that are going on right now absolutely impact me every single day. And You asked about my family. My wife is a pharmacist at one of the hospitals that is owned by the hospital system that owns our office as well. So she is being impacted by this as well. But we also are raising 3 young girls who are now, the twins are 10 and Ella is 12. And so they are being impacted by all of these things because they have classmates and family and that are the classmates' families that are being affected by all of these things. So it is very, very important and very, very pertinent to where we are and what we're doing.
Yeah. And I think that what you've touched on, it's really important also for the audience to hear this in the perspective of, we're not going to lean one way or the other too politically. Like Gerry's very good at explaining things very matter of fact. We had really good conversations in Vegas about a lot of this stuff, hence our conversation here. And also the fact that, you've got a project coming up that we'll talk about towards the end of the show that I think will be very interesting for folks who maybe want to dive a little bit more into this and really educate yourself with a lot of the challenges, I would say, coming out of the decisions that are being made within the administration. So Gerry, with that in mind, could you give us like a little bit more insight and specifics around how your community that you serve is being impacted one way or another by some of the decisions and some of the policies that are coming out and what you guys are doing to kind of support it nonetheless?
Sure. Navigating healthcare is difficult even in the best of times, especially in the United States. And so we have been dealing with a lot of, the best way to put it is conflicting information. It's stuff that may or may not have a scientific basis. It's stuff that may or may not be accurate or may be related to prevailing pop culture theories or other things. But traditionally and classically, there was this idea that medicine was about opinion or it was about practice, because people hear those words and they don't always understand the definition or the context of the word that we're using them. And so when we talk about taking care of patients and doing the things we do, people don't think of us as scientists, but that is what we are. And so a lot of the political decisions, like you said, we're not going to come down one side or the other, but a lot of political decisions on both sides are coming out that are not based in science. They're based in how things feel or how people will react to them or where the money is, just like always. And that's why having political drive overshadowing medical practice can be very dangerous.
Yeah, very well said. And that's something that has been on my mind a lot, just as somebody that I'm not very strong on the scientific side. I have a lot more of that feel, but I do recognize that as something that I need to just be very aware of personally. It's why I have friends like you to help me figure out and navigate some of these things, along with other doctors that I talk to for family medicine and for my own family and medical practices that support my family and kind of extended family. So, I think that it's really important to hear perspectives like this. As we look at the current administration and some of the things that are happening in politics, what are some standout things that you think are kind of prevalent that make you a bit worried as a scientist and as a medical practitioner? What are some of the things that are concerning to you? And then, actually, let's just start there. What are some of the things that are most concerning to you?
There's a lot of discussion of things that kind of prey on the fears that parents have. We all want our kids to be healthy. We want them to be safe. At least I hope we do. And because of that, there is a lot of emotion surrounding taking care of kids and being a parent and taking care of yourself and dealing with healthcare. And so there are lots of people that are playing on those emotions that are doing it in order to achieve a certain goal. And so it is making it really hard for us sometimes to talk about the actual science. And to be brutally honest, what's happening most often is there are things that are conjecture or would be a good place for study or are just in their infancy that are being talked about as if they are fact, or if they are a known fact, as if they are a known fact that has been known for decades, when in fact, they're not even confirmed yet. And so that is one of the biggest things that we're dealing with, is that there's a lot of stuff that is being touted as science that isn't. Prime example, if you look at the vaccine discussion that is going on right now, very in depth, and we've talked about vaccines before, the idea that these mRNA vaccines are causing all kinds of horrible side effects and problems is, from a scientific standpoint, incredibly overblown. We want to be safe. We want to be careful. We don't want to hurt people. But at the same time, there are things that are going to happen with anything that we do with the human body that are going to become more and more prominent and obvious as we do it more often. That does not mean that we weren't expecting that to happen or that we weren't prepared for it, but it does mean that we have to be careful and that we have to proceed in a way that is going to be safe for the people that we're helping. And so when we talk about vaccines, existing vaccines that we use for things like mumps and measles and rubella and tetanus and diphtheria and pertussis, all of these infectious diseases that most people have never even heard of, let alone seen in person, those kinds of diseases that we have essentially shrunk down to so few cases a year that people kind of mythologize them. That kind of discussion can be very difficult because people don't know what to expect. They've never seen somebody who's actually had the disease. They've never talked to somebody who's actually had the disease. They haven't had enough experience with large numbers of people having those diseases. And so they don't have the background that's important for understanding how to take care of those things and how to prevent them from happening. There are also issues with, we talked about initially in the conversation, we talked about AI before coming online here. And the idea that AI in medicine has a role. It does. For the last 6-7 years at this point, I've been talking about how AI is going to make a huge impact on what we do. It isn't all Chat GPT and Google and all of the other Microsoft. It's not a Copilot versus Chat GPT problem. What we're seeing is there are models that help us interpret data. There are computers that do not forget things. They are helping us to bring together a lot of different disparate pieces of information that may not always come together. And so they're allowing us to expand our ideas further and do more research. But because of that, because of how it's working in the private sector, it's making people think that research is going light years ahead of where it is. And so, again, we have that same problem that we've had all along, which is popular culture makes medicine look like it should be magic. And medicine is still, it's not quite the Stone Age, but we're not nearly as far along as people think. We're not the Jetsons yet.
Yeah, and you touched on a couple of things that I want to go back to, thinking about the public opinion or the public, let's say, observation of medicine, and also this, idea of informed consent and making sure that, and you've talked about this on the show too, right? Like, we want to be informed about what's going into our body and make the right decisions and be empowered to do that. And also being a thoughtful citizen and thoughtful part of society. Can you talk a little bit about where that kind of marries up also with the Make America Healthy Again side of things that we see really prevalent in the news?
Sure. So there are many tenets of Make America Healthy Again that I agree with. We need to eat better. We need to take care of our bodies. We need to get physical activity. We don't necessarily need to vilify all of the things that are being vilified in the Make America Healthy Again context. And we also need to be careful of using resources that are going to give us the right information. So as you said, being informed is incredibly important. And we don't want to put extreme weight on any one source of information. We want to make sure that we're getting variable sources that are coming from multiple different places and then comparing that information to find the truth that lies within all of those different culturally influenced discussions. So you mentioned the Make America Healthy Again report. That report came out, and initially when it came out, it was very obvious that the creators of that report had used some form of LLM, large language model, what some people call AI, to generate the report because it was giving references to articles that didn't really exist. There were citations in there for journals that didn't exist or articles that didn't match the description of what they were being cited for. And as somebody who has been using AI for many, many years, it was very obvious right off the bat what had happened, because a lot of times if you request citations for information, especially medical information from one of the LLMs that are prominently used these days, those citations are never going to be fully accurate. They're getting better, and they get better every single year. But even right now, there are going to be citations that make no sense and point to bad information. And so the key to knowing how and who to trust is going to be essentially, and this is hard because we as human beings, we like to have concrete information. Is it yes? Is it no? But the key is going to be being able to say, we don't know yet, but we are trying to figure it out. And I think that, as parents, that's one of the hardest things sometimes to do is we want to make a definitive decision and we feel like we have to make it right now because our kids are only young for so long. But it is okay to say, I don't know.
Very well said. That was extremely articulate and thoughtful, I think, on how we balance this, because we don't want to necessarily I like what you said, right, about how that report wasn't all bad. I think that we see a lot of vilifying of some of the things that are happening, and I'm a big proponent of, like, let's look at things objectively, whether you're on one side of the aisle or the other.
Yeah.
I think that this is one of those situations where we really have to look at the minutia of the details. Now, you talked about, kind of informing yourself and being proactive around some of those things. As parents are listening to this podcast, what are some of the things that they could do to really stay engaged in the current conversations in a, let's say, like a responsible way that doesn't necessarily magnify one side of the aisle or the other, and really cut down to the truth of it? Because to your point, like, parents are concerned hearing about all of these things, rightfully so. How do we just cut down to what is the fact versus all the noise around it?
Well, first and foremost, I'm going to say that 90% of it is going to be noise.
Yeah.
Whenever medical information is put into the public sphere, whenever it's used to create a headline or an article, there is an underlying cause for that. Just like when we say that when there's a commercial for a drug, someone is trying to sell you something, right? So you have to take everything they say with a grain of salt. That's why we have all of these restrictions around how they can advertise and what they advertise, and they have to list all of the potential risks and side effects that go with it. Just like that goes along with anything else that we take. If you are just getting the one side of information, it's going to all look like it all points one direction. And so understanding that when you have articles that have more kind of confusion to them, or not confusion necessarily, but lack of certainty, is actually a good thing in an article. If they say, well, this is what it looks like could be going on, but we're still trying to figure that out. Even in the headline, those articles are going to give you a lot more information that you can actually use. It's going to be more of the actual boiled down facts. If it says this, and this is what it means, you can almost guarantee that that is not what it says, and that is not what it means. And that is hard, because that's what we like to think is going on, is that this is, especially when it reinforces what we already partially believe. So what I tell patients is talk to your doctor, stay informed, pay attention to social media for sure. There are going to be things that will point you in certain directions, but be careful of the sources that you're getting that news from. There are across the United States, at least, and internationally, there are other groups that do this, but in the United States, all of the major healthcare groups that are centered around specialties, so the specialty groups for medicine, tend to have information that they are putting out that is closer to the scientific side. Now, there are caveats to that. There are some groups that are not actually subspecialty groups. They are just groups of people that have joined together because they all think the same things. But as far as the subspecialty groups go, so the internal medicine, which is one form of primary care, you've got family medicine, which also takes care of children, you've got the American Academy of Pediatrics, all of those groups tend to have information that they're going to put out that on the surface is pretty well vetted. There are times where there may be things that sneak in there, but in general, those groups can usually be trusted. Traditionally, we would say that the CDC and the NIH and the WHO had a lot of good information, and they still do. But we do have to be very careful with any of that information, just like everything else. Anybody that is trying to report on scientific fact should be proposing scientific fact. They should be saying this is what we think, and there should be some level of uncertainty. And that is the hard part, because like you said, everybody wants the concrete answers. They want the details, but the details are going to be incredibly boring, and you're going to have to read the article to get to them. And that means that you can't just focus on headlines. And so that's going to be the hard part for gathering information quickly, because we live in a headline society, unfortunately.
That is true. It's very unfortunate, and but it is the truth, right? Like, and I think that you mentioned the role of AI in a lot of this. It was startling to see some of the reports coming out from the government. You talked about even like looking at NIH and Health and Human Services, like kind of that what should be a real source of truth kind of being muddied a bit with opinion versus fact. Now, as we look at what AI is doing to society, I think there's a lot of goodness that AI can bring to the table, and we've talked about that, and I think that you agree, but there's also a lot of unknown and a lot of caution. as we look to the future, if you were to look in your magic ball, like what role do you think AI is going to play in potential misinformation around medicine, and how can we start to think about getting ahead of that?
So the short answer is it's already creating enormous amounts of misinformation because it is not putting out scientific information. If you go right now to one of the large language models and type in, how do I take care of insert disease process here? The information it gives you may be mostly accurate, but it is going to slip in things that are not going to be accurate about 70% of the time. And that's an average right now. That's kind of the most recent study that I read that was looking at the standardized large language models that everybody is using. So from the big corporations. That means that 1 out of 5 times you're going to get exactly right information. That is not a good track record. So you have to be very careful. You have to pay attention to the things that, that if they set off the parent alarm, then absolutely look for other sources, kind of back it up, look for other resources. There are several different vetted groups. I mentioned the American Academy of Family Physicians, the American Academy of Pediatrics. Both of those groups have essentially encyclopedic information. So it takes a little more reading and a little more evaluation. But if there's something that catches your interest or that looks like it could be suspect in the AI information that you're gathering, go to one of those groups and look at the same terms, look for the same terminology, see what they have to say about it. If it matches up, then you can usually trust it. If it doesn't, then you can kind of disregard that information and kind of move on. As far as AI going forward, protecting ourselves from it, just being aware that there are going to be lots and lots and lots of sources that are going to use AI, which means they're going to get things wrong until we start having better reference material used to train the AI. The reference materials for medicine and looking things up, like right now, if you put something into an LLM, you're not Google searching, you're not getting back factual information. You are getting back a series of words that statistically should follow the word that came before them. And so that is hard for people to get. But the idea is that if you have 30 articles that are incorrect or spouting bad information, that will make the LLM spout the same information. So we have to be careful of those levels, that level of hallucination.
I wonder if we can get to the point on that. Like, I wonder if we can get to a point where the LLMs are able to actually decipher factual but it's all, I don't know. Like, because then
we're headed there.
Like you have the other side of the coin where people are like, oh yeah, but is it telling the truth? Like, like being very skeptical, which I think is healthy. I think skepticism is healthy to a degree, but at the same time, I'm like, okay, we have to kind of believe one way or the other. It's just, as a parent, I feel like there's a really weird line that we're trying to walk.
Well, for most of the parents that are listening to this, I'm going to bet that they probably went through a span where Wikipedia was a thing. They may not have been in high school or undergrad, but they could have been. And the idea that Wikipedia was created by a bunch of people, and so it was not as trustworthy, was very prominent in education for many, many years. Now it's the only reference material that half of America uses for when they look something up, right? Because we know that it came to a point where the information became more trustworthy. Does that always mean it's correct? No, there is always spin on everything. But if we have people from both sides that are working together, or more than two sides, from every side that are trying to work together to create information stores that are as accurate as possible, we're going to come to that middle ground. And it's going to be less sensational and less exciting and less bombastic, but it is absolutely going to be trustworthy, which is what we're really looking for. The other piece of this is in the context of probably 5 years ago, I gave a talk about one of the things that has been on the horizon and is still happening very much so right now, which is the creation of what we call centaurs, which that term hasn't really stuck, but it's the idea that if you put an AI and a human together, they work a whole lot better than an AI by itself or a human by itself.
Yeah, well said.
And so the centaur idea for medicine is kind of how we are using AI in medicine right now. We're taking physicians who are well-trained, who understand what's going on, who have the factual knowledge, who are scientists, and we're giving them these tools that allow them to have a perfect memory, that allow them to access outside of their normal field of evaluation, that are allowing them to access large volumes of data and essentially summarize that data quickly to be able to move forward faster in a straight line rather than having to spend as much time on what we call differential diagnosis, the idea of figuring out what exactly is going on. We also have AI that's being used in, say, imaging We can't necessarily tell the difference in color between one pixel and another at high resolution on most images. So when we're talking about large volumes of data like that in an MRI, or especially right now, mammograms, those are being interpreted by AI, and then they're telling the physician, hey, look at these things very closely because I'm seeing something that your eye may not pick up. That's huge. That allows us to see things sooner. That allows us to catch them faster. And especially with things like cancers, time is life. And so there are benefits to having that kind of information processing, but it needs to have humans, at least right now, to be able to process it. So that's another thing that I usually tell patients is be very, very careful of trying to use one of the LLMs as your doctor, because it is going to mislead you. It is going to point you down pathways that may make it less healthy for you if you don't also have a scientist backing that up.
Wow. Yeah. Don't forget the human component to all this, right? Like that's a huge piece of this. And I look a lot at AI. Obviously, there's a lot of negative that we can point to with AI. There's a lot of goodness. I really like that idea of, like Microsoft uses the term co-pilot, because it really is meant to be a kind of a partner, a collaborator with you. And as we look at even on a deeper end of the spectrum, not just an LLM, but the sort of quantum computing and other pieces to the puzzle that is coming into play on how we process information, like what you were talking about, looking at images and understanding really what we're seeing that is maybe invisible to the naked eye. As we look to the future and even seeing like cancer research being done with AI and some of these other things, what are some of the, looking in your magic ball again, if we were to think about the role that AI is going to play in that research side of the house, what do you foresee as being maybe most exciting in that regard?
The biggest thing that it does, I already kind of mentioned, which is it has perfect memory. It never forgets. And it can also pull in information from outside subspecialties or outside the narrow window that a lot of researchers work in. They may be specialists in a very specific area, but there may be breakthroughs in other areas that they're never even hearing about that it can very quickly parse and already have in its memory and in its data banks. So that ability to collate that information that is massive volumes, we've already come to a point where not every doctor can understand everything about everything. It's not, the 1950s where we had 19 medicines that were commonly being used. We have over 1,900 medicines that are commonly being used right now. And to understand all of the side effects and all of the interactions and all of the things that create a web of data, it's a knowable piece of information, but it is not knowable by a human brain for the most part. We are not that good. And so having something that is going to be a huge tool, and is already a huge tool for us to be able to use that in the right context. It takes feeding it the right amount of data in the right way. So it still takes a human element to make sure that it's getting all the pieces, but it is absolutely a lifesaver, literally every day. We are using it already. People just don't realize it. It's going on in the background, helping us to make decisions, helping us to look for things that we wouldn't otherwise look for, helping us to make sure that we don't miss things that may have been overlooked. So it is already in the background processing that information and spitting it out to us in a way that helps us make those decisions better.
That's pretty remarkable. I love seeing how we can use technology in tandem with the very human things that we need to do as a society. And one of the most human things that we could do is really taking care of each other. And that's what doctors, I think of doctors as some of the best caregivers in the world, and what they're trying to do for society, and especially thinking about you and the work that you're doing within the underserved communities that you serve. I think it's going to be, as you said, it's already a game changer. So that's super amazing. Now, we've talked a lot about some of the ways that we're trying to navigate. We've given some ideas on let's say the right ways to go about researching things for yourself through some of the muck that comes out in media and different tools that we're trying to leverage, like AI, to the best of our ability. But I think about a lot of parents who are listening to this show. What sort of, let's say, coming back to that caregiver side, what sort of reassurance would you give parents, given all the uncertainty in the current state of medicine right now, at least here in the United States, and I'm sure some other parts of the world? But yeah, what sort of reassurance would Dr. Gerry Tolbert give to the audience out there?
There are still people out there working to make sure that we get adequate and accurate scientific information to be able to help people stay healthy. And we are working hard, whether we are loud and vocal about it, and whether we're on podcasts or on the internet or just in the clinic down the street, we are still here, still trying to help. And there are lots of us. And so understand that it is not forever that this information will be so confusing and so overwhelming. It will slowly and surely move toward a time where that information is more accurate, as long as we all work together to keep it that way. So if there are things that you care about, ask those questions, find those people. If you want to ask a question and your primary care provider or your child's pediatrician or whomever medical professional you are talking about, whichever that may be, doesn't want to answer the question or gives up an answer that is suspect or questionable or you have concerns about, ask someone else. There is a fear a lot of times of asking questions, and the only way that we're going to find answers is by asking questions and being open to whatever the answer might actually be. Sometimes we're going to be wrong, and it is okay to be wrong as long as we are being careful.
That's very well said. I feel reassured. I thought a little bit about one of the last pieces of what you just said. I think a lot about the confirmation bias that we see very prevalent in society, but especially today with social media being so prevalent. How would you recommend, or how do you even think about checking yourself for that confirmation bias in that regard?
The biggest thing that I'm fond of saying to patients all the time is I have no problem saying I don't know. So if I am even a little bit hesitant or I doubt myself a little bit, I will still go look things up. Things I am sure of 110%, I will still look them up. And I will tell patients in the room, hey, I honestly haven't looked at that in a couple of months. I know what I understood at that time, but let's see where it is right now. And we will look it up together, and I will explain to them what I'm looking for and where I'm trying to find it and try to go through it so that we know that if there is any ambiguity or there was ambiguity in what I understood or I misunderstood it and things have changed, absolutely, I am willing to admit that freely. There is no harm in being wrong. And I think that is the key to confirmation bias. We are so afraid of looking like we are wrong or being wrong that we have, as a society, we have made being wrong this horrible, horrible thing, when in fact, it's the only way we learn anything.
Gosh, that's so important. I think that people need to have a little less ego when it comes down to all this stuff. And that honestly comes down to one of the other things that we talked about earlier on, which was bringing things back to the middle. Not to necessarily appease, but to be open to listening and to be open to the perspective. And that's a big part of what I think I wanted to accomplish with this episode and this conversation, was to really bring to light the right ways to facilitate that through research, through discussion, through gaining opinion and perspective from others. That's a big part of this show, but also a big part of this conversation. So Dr. Gerry Tolbert, that was fantastic. I really appreciate that. Any other kind of final words on that before we touch base on one of the new projects that you have going on? Any other words of wisdom for the audience?
Again, never be afraid to be wrong. Always be willing to look things up and to understand more. Yeah. And don't be afraid to ask questions. I think that one's probably the most important. Ask questions. There's never a stupid question. There's never a stupid person. It is mostly about, I shouldn't say there's never a stupid person. I've been stupid many times. But never be afraid to ask a question because you think that somebody's going to look down on you or they're going to think you are ignorant, because we're all ignorant of the things we don't know. That's why we have doctors. That's why we have specialists, is because there are going to be things that somebody knows that we don't, and we need their help.
Yeah. Yeah, well said. Now let's also talk a little bit about the project that you and a fellow friend, Scott Johnson, are working on. And by the time this episode comes out, there should be some kind of an announcement coming from you and Scott around this. But yeah, talk to us a little bit about the program that you guys are putting together and what people should look forward to, especially if they enjoyed this conversation.
So Scott approached me a couple of months ago about putting together a podcast about navigating healthcare, about questions that people have, about busting myths around healthcare. And so we decided together that we would put together a 6-episode first season of a show we're calling The Medical Show. Scott has the morning stream, and he has a show called The Monday Show. So this kind of follows the naming convention, still being called TMS, so The Medical Show. And it is going to be a conversation between the two of us about all kinds of things about the healthcare system. How do you find a doctor? How do you ask questions when you go to the doctor? What kind of things are going to, just like we talked about today, what kind of things in terms of reference materials and places that you can go to get good information? What's out there? What are some things in, popular culture that are mythologized that we can really help people get through to make them healthier? There's a lot of information out there. There's a lot of stuff coming at us. How do we sort through it? How do we use it correctly or safely or in a healthy way? And so we wanted to have a conversation about that. So if right now there's a pointer at themedical.show to pick that up, and it's going to be on all of the podcast platforms. It'll be on all of Scott's stuff as well. But we're right now working on getting some episodes put together so that first season can flow smoothly.
Yeah, absolutely. And you can always catch all of Scott's stuff over at frogpants.com. Friend of the show. He's been on a couple times. So yeah, really great to have that sort of a show coming out because this topic, especially what we've talked about today, is very prevalent in society. I hope that the audience really got some good thoughts and perspectives from that. So thank you again to Dr. Gerry Tolbert for being on the show. Where can people find you on all the socials?
So I'm kind of everywhere, but only kind of. I don't do a lot of posting right now. As the show gets nearer, I've kind of kicked around doing some things on both TikTok and some of the other on YouTube shorts and things. And I may be putting some stuff out there, but pretty much everywhere I'm either Dr. Tolbert, DrTolbert, or G Tolbert in some cases. But Blue Sky, Dr. Tolbert on Blue Sky is probably the easiest place to find me frequently.
I'm liking that Blue Sky thing. I'm on that too. I think it's fun. I think it's better. It's a better platform for especially conversations like this. It seems to be a little less magnified in one direction.
Smaller communities. Yeah, exactly.
Yeah.
Smaller communities makes it easier to have good conversation.
Yeah. Well, this has been an absolute pleasure. Dr. Gerry Tolbert, thank you again for being on the Dad Chronicle.
Thanks for having me.
Thank you again to Dr. Tolbert for being on the show, as always, providing great words of wisdom. And make sure to check out his new show with Scott Johnson, The Medical Show, over at frogpants.com/medical. If you enjoyed this show, be sure to subscribe so you never miss another episode. You can find your favorite podcast provider over at thedadchronicle.com, or just search for The Dad Chronicle on any of your podcast providers of choice. You will find it. I am sure of it. And if you'd like to support what we're doing, head over to supportadad.com. Even $1 a month helps to pay for the operational costs to make this show happen. And if you'd like to reach out and talk to me or share your thoughts on this episode or any other episode that we do, you can do so by emailing thedadchroniclepodcast@gmail.com. And thank you again for listening. And remember, be good to yourself, be good to others out there, and we'll see you next time.
If you like this show, check out more great content at incastmedianetwork.com.